evening, everybody, and welcome to this members event. I'm pleased to introduce in a moment or two Louise Archer. She is the Executive Operations Director, and this evening she is going to be talking to us about the new regulations from the housing regulator. I'm going to leave you to share your screen in a moment. Can I just ask if you could all put yourselves on mute, just so we all get to hear Louise clearly. And if you have questions, if you could save them to the end, at which time can you put your hand up and I will try to switch screens and make sure I collect everybody. Or you can always add them to the chat and I can read them out if that's better for you. Okay, so Louise, can I hand over to you to do your thing, and I'll put myself onto silent as well.
Okay, thank you. So I'm just going to let me just take a couple of seconds just so that I share my screen properly so that you can see it and so that I can see as well. So can you see the presentation? It would be great. Okay, thank you. Yes, so the topic for tonight is a strategic overview of the consumer standards. I'll introduce myself a bit further in a moment, but before then, just the kind of agenda for what I'm going to cover. So I've kind of posed it as a series of questions. So they're kind of questions that you might ask about the consumer standards. And so I have aimed to try to answer those, understand a little bit more about what they mean, but just in a kind of overview way. Don't worry, I'm not going to go into the detail of them all. And then just a little bit on where Broadland is in compliance with those standards. So as Paula said, I'm the Executive Operations Director. So basically that covers those kind of services mainly that are directly to our residents. And some of those are listed there, like the housing management repairs service, and also some of things like health and safety. And yes, I've been at Broadland 16 years, so it was 16 years on the 5th of November. So just a little bit of an overview really on how we are regulated. So we're regulated by the Regulator of Social Housing, who feed into where MHCLG then became on this diagram Department for Levelling Up Housing and Community. So this diagram now is a little bit out of date because it's back to Ministry of Housing, Communities and Local Government again. So it's MHCLG. And you can also see that we do have relationships with other regulators as well, such as the Building Safety Regulator, which is for high-rise buildings. And then there is the Housing Ombudsman, who isn't a regulator, but does look at complaints and disputes between residents and landlords, and does have some powers to impose fines and ask us to do things as well. But tonight we're going to be talking about the Regulator of Social Housing, and more specifically the consumer standards, which have a direct impact on all of our residents. So this is my first question. Who is the Regulator for Social Housing? So this is who they are. They are responsible for regulation of social housing providers, and they look at the way that we are governed, our financial viability, value for money, and then also our services to consumers. And the consumer standards are part of the regulatory framework that's set up by the Social Housing Regulation Act. And this put the consumer standards on the same footing as the economic standards and the governance standards that we previously had. And it gave the Regulator of Social Housing powers to regulate and enforce them. And how they do that, they would carry out what was called an in-depth assessment, but I think now they're calling an assessment every kind of 3 or 4 years. And that would be based on risk. And then they would provide a judgment. So it would be a V for the viability, G for governance, and now the new C rating, which is for consumer standards. And the consumer standards also apply to local authorities. So the regulator, they can monitor us, they can ask us to make improvements, they can actually impose unlimited fines, or they could even step in if they think there are serious problems with the provider. And also, this is important in other areas as well for funding, because if we are well run, then banks and private finance or other finders will find us more attractive and less risky if we have good levels of regulation. So our next inspection will be next year, where we'd find out what our C rating would be, but currently we have a level 1 rating for governance and a level 2 rating for viability. So why were the consumer standards introduced? This really came about by a series of high-profile incidents and more increased public scrutiny on social housing management. So, for example, the tragic death of toddler Awa Bishak due to exposure to black mold, and other media investigations highlighted the need for stricter regulations and better housing conditions. And previously, kind of in our previous inspections, the kind of consumer and the service to tenants wasn't really scrutinised or investigated at all. It was more on that regulation and financial viability side. So this is now strongly bringing in the consumer side as well. So what are the consumer standards, I hear you ask? So they apply to all social landlords, as I said, including councils and housing associations. And there are 4 main consumer standards, and I'll go through a little bit more detail on this later. And they form part of our package of regulations. As I said, they're designed to protect our tenants and to improve the services they receive. So this is the aim of these consumer standards, as set out on the slide. So it's to provide a proactive regulatory approach, including routine inspections and enforcement powers, and it's to hold landlords accountable. But the standards also aim to increase transparency and accountability among housing providers, and allow tenants to have a greater influence on how their homes are managed. And these standards are designed to protect tenants and improve the service they receive. So part of it is about being clear about the services that we provide to tenants and what they would expect. So that's where part of it comes from, people being clear and understanding what that service should be, and to hold people to account for those. So these are the headline standards. So there's the 4: neighbourhood and community, safety and quality, tenancy, and then transparency, influence and accountability. And then there is a code of practice which relates to the consumer standards. It isn't actually part of the regulation, but it helps registered providers, so social housing providers, understand what the regulator is looking for. And the responsibility to meet the standards, it lies with the board. So it's the board to be happy, satisfied that the organisation is meeting those standards. And this code fits with the co-regulatory, easy for you to say, regulatory regime, as it allows providers to develop their own approaches to achieve the outcomes and expectations, and for tenants to be also involved with that. And so I'll just go into a little bit more detail of an overview about what each of the standards is about. So the neighbourhood and community standards, so there is the headline there about it requires us to engage with other relevant parties so that tenants can live in safe and well-maintained neighbourhoods and to feel safe in their homes. So this is all about local cooperation, so working with relevant partners to promote social, economic and environmental well-being in the areas where social housing is provided. So for instance, this would mean things that we do, like working with other local authorities, police and other organisations. It could be working with other parties to deter and tackle antisocial behaviour or hate incidents. So it's really about that kind of community feel and making sure that everyone is working together who is involved in that community. So the next one is the safety and quality standard. So this is all about tenants feeling safe in their homes and also the standards of the homes. So this requires us, so it's part of it is about data as well. So to make sure that we've got accurate, up to date and evident understanding of the condition of homes. So part of this is when we do our stock condition surveys, where we go around and we look at each home inside every 5 years. And this is to make sure that we understand what condition homes are in and whether they meet the required standards. So then this should mean that it informs us about that are the homes good quality, maintained and safe. So this is about making sure that that golden thread of information comes through to the services that we provide. It also includes all the requirements for health and safety, in which there's quite a lot, and to take all the reasonable steps to ensure the health and safety of tenants in their homes and communal areas. So, as I said, there's quite a lot of things. There's things such as the gas servicing, that's the annual gas safety check, around fire safety, around checking water, checking lifts, checking electrical standards, all of those kind of things. And also it puts the concept of managing antisocial behaviour well as part of safety, so as part of people feeling safe in their homes. And the next standard is the tenancy standard. So this is about providing clear information to tenants about rights and responsibilities, and also ensuring that the neighbourhoods where tenants live are safe and well maintained. So this is also around allocation and letting homes, so making sure that that process is fair, as well as looking at how tenancies are managed and how tenancies are ended, and are they ended in a fair way as well. And there's specific expectations to cooperate with local authorities and their strategic housing functions, and assist the local authorities with their homelessness duties, and develop services to address under-occupation and overcrowding in homes. So this is all about the kind of housing management function around homes, and also things like where it says about clear information about rights and responsibilities. So this is about, for example, tenancy agreements in an easy read form, and also having information available, for instance, on our website about the rights and responsibilities for tenants. And the last one, this is the transparency, influence and accountability standard. So short and snappy title. So this is really about making sure that we are accountable to tenants, that they're treated with fairness and respect, and also have a say in how their homes are managed. So this is about kind of getting information from tenants, but also giving opportunities for tenants to provide a scrutiny function about our services. It covers communication and making sure that that is clear, accessible, relevant, timely and appropriate to diverse needs. So for instance, providing communications in different languages or different size fonts, but also the way that we communicate in that it is in an easy, understandable and clear way. It also requires landlords to provide accessible support that meets the diverse needs of tenants, so they can engage with opportunities to influence and scrutinise. So making sure that we do provide that opportunity, that we take tenants' views on board, and we show how we've taken tenants' views on board. This could be around our strategies. the services we provide, and also our policies. And we have an example of this as we've recently put in our service standards document. So it should clearly set out what the services are we provide. In some cases, the services that we can't provide as well, or the services that are the responsibility of other agencies. So really being clear on those things that we can do. And then we have the opportunities for scrutiny. So we have a tenant assurance panel, and that panel looks at the services we are providing, looks at our performance, and has recently looked at 2 areas that they would like to look at in a bit more detail. So where are we with compliance? So these consumer standards came in on the 1st of April 2024. And at that point, we were expected to fully comply with them. So it was like a day 1 compliance. So what we did was we went through all of the consumer standards. And I mean, I've given you the headlines, but below them, there was a lot of other points and a lot of quite other detail with areas we had to comply with. We saw that we had some gaps. And at that point, we had 32 amber areas and we had 2 red areas. So we took it to the board, and the board thought that it would be best for us to let the regulator know of our position, because this is the expectation of the regulator, that if you have concerns, even if you have an action plan to get to those areas, which we did have, but you should let them know. It's better to refer yourselves to the regulator to let them know than for them to find something out. So we said that we would let the regulator know about where we are. The regulator came back quite quickly, and they asked for a copy of our action plan with target dates, because we'd already kind of gone through that and said that when we would be compliant with all areas. They then came back and asked for some more questions and some more details around things about some of the areas where we'd marked as partially compliant, because also at this stage, everyone else was kind of finding their feet with it. And so it was quite difficult to understand how far away we would be, or what really was an amber. So we sent those details back then, and it went for quite a long time. And then eventually they came back and said they wouldn't be asking for any further detail, or wouldn't be taking this any further, but they would include these items that we'd said where we had some gaps in their next inspection. So they were happy with that. And I think generally that is the kind of approach with the consumer standards, that if you are aware of where your gaps are and you're doing something to address it, then they are happy with that. In terms of the when they come in and do the inspection, they will grade us between a C1 and a C4. So C4 is you've got terrible problems and you're not going to be able to comply with this. C3 is where, again, you're not compliant, and you probably wouldn't be able to have the resources to do that. But C2 is where you're not 100%, but you're aware of where you are, and you've got measures in place, and you've got resources that mean that you would be able to get to compliance. And C1 is still not 100%, but it means that you're kind of broadly compliant with all the areas. And if you've got something like you've got an action plan and you've got areas that you're working on, you're continually improving. And the first round of those inspections has happened, and there have been some C1s given out, and there have been some C2s, and there have been some C3s. C1, yes. So C4 is actually non-compliant. So yes, so they were happy with what we did at that time. So I guess that means there was a few people who are in a similar position. We also put a statement on the website so that people could see the areas that we wanted to improve on. the kind of key headlines where we want to improve the information that we share with tenants about home and neighbourhood and services you receive. So obviously we then had the service standards document, and ensuring this information is accessible to all residents and you can scrutinise it and hold us to account. And also wanted to improve our response times to complaints and achieving compliance with the Housing Ombudsman Complaint Handling Code, which we have also now done. And for the past few months, we have complied with the response times for our complaints. So that's good news. Also improving the way we identify and record when residents need reasonable adjustments from our service. And so since then, we've put in place a reasonable adjustments policy. And we said that our July edition of Door to Door magazine, which is the magazine that goes out to our tenants, will provide more information about the consumer standards and what actions we are taking to improve in these areas, and that we'll be publishing the results of the tenant satisfaction measures and an update on what we have done in response to feedback. So tenant satisfaction measures are part of the consumer regulation, and we send these out each year. We're now starting our second round of these, and they will give us information on where people are happy and where people are less happy, areas we'd like to improve, and also we'll be able to hopefully compare with other organisations. So since then, as I said, we've worked through the action plan, and we had cleared 12 areas by May, and currently only one area where we are amber, which is in relation to the revision of a policy, which will be resolved by December. So just as a recap, and hopefully I've covered some of the questions that you may have had in your head at the start of when I was going to talk about consumer regulations. So we've covered who the regulators are and what role they play, why the consumer standards were introduced and what organisations must do to meet them. I then had a brief overview of each standard, and then I've just updated you on Broadland's compliance and where we are with them. So really now it is over to you for any questions. And I guess if I stop sharing now, it might be a bit easier.
Easier to see people.
Yeah.
Thank you. I've only got 2 screens then to flick through.
Yeah, I can't see everybody on one screen, I don't think.
So Francis, you have your hand up. Hold on a moment, you're still. You unmute yourself. Yeah.
In relation to the regulations, is it specifically for social housing or is it in general, all tenants, including private landlords?
It's for social housing landlords, so that we are regulated by a regulator of social housing, so it does just relate to social housing and specifically housing associations on the governance and viability regulations, but including local authorities on the consumer standards.
Mm-hmm.
And it would be good if it applied to all, wouldn't it?
If you have a persistent C4, and if you're really below the regulator, would they sort of say, look, that's it, you have to shut down this? Or do they offer any other, possibly financial assistance if that is selected?
Yeah, so they could force us to merge with another organisation. They could bring in a whole new board, for instance. They could bring in other people to try to sort it out. The regulator would probably come in and go through a lot of our services, give us a list of areas where we needed to improve by and by when. There's been quite publicly a few organisations in the press where, you know, they've been in trouble, and you can see what the regulator's done to do that, and some of those have ended up merging with other larger organisations. But there are, they could fine us as well. That's another one of their powers. So it does really, I guess it depends on how bad they think things have got and whether you have the financial resources and the people resources and the skills to be able to comply with those required standards.
Does that cover everything, Francis, for you?
Yes, I'm just wondering what sort of regulation usually stands out if you take social housing. Where is the defect usually? So that comes on again and again, which needs to be handled.
So I think you're asking kind of like what are the common areas where people fail?
Yeah, in terms of social housing.
Yeah, I mean, I think it's probably too soon to tell in terms of the consumer standards, because I mean there haven't been loads that have come through, but I think some of the things that I've seen that are quite common are in relation to health and safety. So you see quite commonly with people who haven't carried out their fire risk assessments, or they haven't done all their electrical testing, things like that. That's some of the ones that you kind of see in things such as inside housing, which is the kind of press for the sector. There does seem to be quite a big focus, understandably, on health and safety, and that's often an area where people may have fallen down.
Thank you, Francis. Is there anything else? Yeah, cool.
Is that helpful?
Helpful? Any other questions? I don't see. I'm just going to flick through my screens. If there's any other questions, only hands up. James, do you want to go?
Question. It's fortuitous. I was yesterday at a meeting with Emma Payne, who is now the Director of Social Housing. So we were talking about the gradings, and we talked about the number of local authorities that have received C4 gradings, and how Homes England has reacted to that. That a lower grade will basically mean no funding. Our small group indicated that wasn't a very good idea if they turned the financial taps off. But are you sure that when we go through the audit next year, that we will get a C1?
Well, I mean, you can't say that for certain. I mean, we're obviously trying to ensure as much as we can that we are where we need to be. I mean, in the initial round, some of the local housing associations have achieved a C1, but I think the regulator is constantly learning. They'll be learning from those inspections. They'll be deciding what they want to see more of. They might get more harsh. They might raise the bar a bit on the next round because these are the initial people who went through it. You never know what they're going to ask or what they're going to, until they get there, really, and what areas they'll really dig into. And I think, yeah, I mean, it should be helpful for us as well to see what kind of questions they ask, then we know where to concentrate on potentially. But I don't think there's any guarantees that we will get to a C1. But yeah, we're trying as hard as we can to do everything that we think we should be doing, but I think until you go through it, it's hard to tell.
Currently on the overall standard, we're a G1 V2, aren't we?
We are, yeah.
Yeah. And
right.
A second point that was raised by one of the civil servants at the department was resident engagement, and how they're focusing more and more on resident engagement as registered social providers to ensure that they're engaging with the residents on quite a broad spectrum of engagement, not just focusing on one area.
Yeah, that's right. I mean, so yeah, so
have you any plans to increase resident involvement?
So I suppose there's two areas. There's kind of like involvement engagement, and there's also the scrutiny function. So we have the tenant assurance panel, for people who don't know, that's for our scrutiny function. And in terms of involvement engagement, we have a suite of things that we do. So we have things such as a digital panel we've got a number of tenants on that, so we can send things to them electronically, like a policy or procedure for them to have a look at. One of our big areas is our out and about. So that is when we go out to a scheme, and it's scheme by scheme. And we go and you ask, what does Broadland do well and what could Broadland do better? And we gain a lot from that. We are programming that around the schemes that were the least happy from our survey that went out, satisfaction measures. And so, we've increased how we're doing that. We used to just do it over a certain amount of time, whereas now we are doing that all year round. So we will get round as many as we can. So we've expanded that area, and then we have other activities. We have like housing for older people. We have community inspectors. We have mystery shoppers. Trying to think, have I covered everything, Paula? All of the activities? Yeah. So really, I think we've expanded it around
the only, I mean, you've got your digital panel who are providing you feedback, and you've got a tenant assurance panel who are conducting an overview of what you are doing. There is no, is there any input on procurement? Is there any input on policies? Apart, I mean, in drafting policies.
So we have been, in some cases we have involved residents in procurement. We could probably bring that a bit more back into the programme again in our procurement policy. In terms of drafting policies, I think we have sent policies for comment. We haven't kind of worked together from scratch, but I guess a lot of our policies were kind of already in place, so it would be revising them. Unless there was a new one that we needed, but I guess it's something to think of.
It was part of the co-production that the regulator was talking about.
Yeah.
And that scores quite highly.
Yeah.
I'll leave it there. Thank you.
Yeah. Okay, thank you.
Jane. Thanks very much. Helen, you've got a question, your hand up.
Hi, thank you. Can you hear me?
Yeah,
yes.
Thank you.
Hi, it's nice to see everybody. I've just got a question about resources. Have you had to direct any funds or resources from any other programme or project you may have been running to address the extra requirements placed on you as a result of the regulatory requirements now?
So I think, thinking about that, I think a lot of it is kind of what we're doing anyway, but just adapting it a little bit. So for instance, we kind of, if we were providing services, it's just making sure that the way we communicate about those services is in a clearer way or more understandable. Health and safety, I think when we looked at that, we were complying with quite a lot of those areas anyway. I think we may potentially have looked at creating more projects to address some of the areas, like we had a project on resident scrutiny engagement, things like that. So I mean, I don't think we've had to kind of say we can't do this project because of consumers, but we have because of consumer standards. But I guess we've sort of incorporated it into the work we're doing. I suppose another example would be around antisocial behaviour, where we've reviewed the antisocial behaviour policy, making it clearer about the services we can and can't provide. So I guess it's kind of like, I see it as more as enhancement of the things that we were already doing. I don't know if anyone else has got any other views here on that side of things. Anyone else wants to add to that? No.
I guess I'd say, Louise, as well, when we looked at the standards as well, some of the things we've always done really well. So aids and adaptations, for example, we've always had a really healthy budget on aids and adaptations, and actually we do a lot more than a lot of people do. So on things like that, we've kind of always met that. But there are areas that are increasing. Certainly domestic abuse, that has increased in terms of what we're expected to do. So we're undertaking the DAHA accreditation. That didn't come to us with a cost. That was funded by Norfolk County Council. So there are other people that are contributing to helping us do this, and I think it's some of the stuff we do really well, but it's maybe certain areas which are now getting more priority where we've maybe just stepped up a bit. Would you say, Louise?
Yeah, I think so. I think when you think of 32 amber areas, that's quite could be sounding quite alarming, but it was because we were almost there. We just had to do a little bit more to something that we were already doing. And then some of the kind of red gaps were around not having certain policies and procedures in place, like we didn't have a lift policy at the time, which we now do have. Yeah, does that answer your question, Helen? Yeah, thumbs up.
Thank you. Yes, thank you. Yes, thank you.
Thanks very much. Are there any other questions? I can't see any more hands up or anyone particularly waving at me frantically. Any final comments? No? Nothing else? Brilliant. Well, thank you very much for coming along. I hope this answered any questions that you have around the regulation, and probably actually got a lot more questions after all of that information. It's quite a lot to take in. Thank you very much, Louise, for giving us the overview, and thank you very much for coming along tonight. We will Laura is busy getting the next programme ready, so we will be getting in touch in the new year, hopefully with a new programme of events for next year. Thank you very much for coming along tonight, and it was nice to see everybody.